Welcome to St. Joseph's House of Repose podcast. We have again with us Karen, the founder of the RADish Ranch. Karen, it's great to have you here.
It is very good to be back here with you.
If you would like to have a bit of an introduction to Karen of how she kind of came to discover kind of reactive attachment disorder and different traumas in that way and her journey there and some more of a long string questions, you can go look at our first episode with her, which is called Karen, Help Me With My Children. Today, we're just going to kind of hear what Karen is up to now and some exciting news and different things going on. But one thing that I've really noticed in the last little bit here, looking at Karen's newsletters and her post, is that she's been using the word trauma responsive therapeutic care. Karen, why are you using trauma responsive? Why is that added on?
So, over the last probably 6 or 7 months, starting kind of the end of last year, I started realizing that there was a piece of something missing in our not necessarily therapeutic care program, but the way it was presented. So, to families, to professionals. So, therapeutic is kind of the healing part. Therapeutic means healing, and it can be for every field. You can use it in the medical field, you can use it in the, addiction fields. It covers a lot. And so I started doing a lot more research on trauma responsive. And I've been familiar with the term for years, but never really kind of did a deep dive. And so trauma responsive means intentionally responding to trauma that has been experienced. And that is exactly what we do in our therapeutic work and our therapeutic techniques. So when I started adding that in, it started bringing in that framework and that mindset that not only is this healing parenting or healing care, but we are intentionally responding to trauma. And you'll hear a lot the term trauma informed. And it's a lot of programs these days use trauma informed. And trauma informed means just exactly that. It is informed about trauma, but it does not necessarily include practices that are helpful for dealing with or healing trauma. So adding in that trauma responsive to our therapeutic care has just really helped to kind of bring in that mindset and that framework that we are intentionally responding to trauma in healing ways with different types of care techniques and programs and practices.
Yes, that makes a lot of sense. That's more helpful, more specific to, yeah, what you do because it's
Yeah.
a broad, well, therapeutic is broad. So,
Right. Yeah. So this kind of,
so
we got a little more niche with our titles there.
another thing is when I'm talking to, especially parents, or it doesn't even have to be parents, it could be my family members who kind of ask what I do. The word trauma is thrown out a lot on different things, and trauma is a broad topic within itself. Can you give a little bit of background on the difference between maybe what trauma is kind of in general, but then specifically what you work with attachment trauma?
Yes. Yeah. And I've had some of the same conversations over the last while. Because again, trauma even goes into the medical field, right? You can have medical trauma, you can have wound trauma. Like the term is so broad. So Gabor Mate gives one of my favorite explanations on big T and little t trauma in his book, The Myth of Normal. And so the terms big T and little t trauma have been around for a long time, but Gabor Mate just has such a way with words. So big T traumas are the big events that happen. So very severe abuse, very severe neglect, kidnapping, combat, war zones, severe natural disasters, rape, those types of things. Can also include severe medical trauma, things like car accidents, brain injuries, all of those things. And it's when there's like this one big event that comes into your life. And the way we perceive that and the way it is dealt with can lead to a trauma disorder. Little t traumas are the things that we work with in attachment traumas or early life or pre-verbal trauma. And they're often, and sometimes it's big T traumas, sometimes it's little, sometimes it's both. But the little t trauma are those little experiences that happen over and over and over and over. Little experiences of emotional neglect or physical neglect or physical abuse, and sometimes that's physical abuse that's been normalized into many cultures. The little events of feeling nobody cares, I'm not good enough, I can't do anything. And it's those little things when you look at them, you can say, there's no way that caused trauma. It's too small. It doesn't really matter. But it's when those are built up over time, kind of sometimes it's referred to as chronic trauma as well, over and over and over, and it starts to change the way we view ourselves and we view the world. And so we end up with the same trauma impact or trauma disorders from kind of a buildup of little t trauma. So then there's also, as you mentioned, attachment traumas. And those are traumas that specifically happen within an attachment relationship. So something like a car accident, a war zone, a kidnapping, a rape tend to happen in more of a global or social kind of form rather than in an attachment relationship. And attachment traumas are so devastating because we need attachment. And it's typically people who we think care about us or who should care about us or should love us or keep us safe or we should be able to have a healthy relationship with. So it's kind of the experience of a trauma that also severely impacts not only the attachment relationship, but also the ability to form and maintain healthy attachments. Then there's also pre-verbal trauma. And pre-verbal trauma is kind of more a broad term in some ways, and it includes trauma that happened before there is the language to understand or explain your experiences of what happened. So when we're talking about disorders like reactive attachment disorder or developmental trauma disorder, we always look at trauma in the first 3 years of life because that's the pre-verbal. And kids at that age, they don't have the words to say, this is how I feel, this is how I experienced it. And so it has a much greater impact on the development of self. And specifically the impact on the development of our internal working model. So our view of self, our view of others, and our view of the world. So a lot of different traumas. The ones, like I said, that we work with is kind of in that pre-verbal period. For a lot of kids, especially kids who've been through foster care, there's often big T traumas, but it's often a lot of little T traumas. Moves over and over again. It can take a lot for kids to be placed into foster care, so they're experiencing kind of chronic trauma throughout that. In adoptions, there's often a lot of little T trauma because some of the trauma experienced with adoption has been normalized so much in our society that we fail to see it as trauma, because being placed in a loving adoptive home is seen as good. And we tend to not see the trauma that's caused because there has been loss when a child is moved to a new home. In birth families, we also typically see sometimes those big T traumas, but often little T traumas. And when the trauma happens in the birth family, in that attachment relationship, there's trauma on both sides, so child and parent. And so it's often just those little things that might not be recognized because the parent themselves is traumatized, or the parent themselves is experiencing trauma or has intergenerational trauma. So yeah, we do see a lot of the little T traumas as well.
Yes. So little T traumas are like this built up of different experiences. So we talk about pre-verbal. Now, when you talk about integrating their like working model and their identity of self, does that have a lot to do with just like the general natural development that we have from the first 3 years of life?
Yeah, so the first 3 years is like our biggest time of social, emotional, and psychological development. And it's something like 75 to 80% of our brain growth happens in the early years of life.
Oh,
Like
wow.
it's so impactful. And
Yeah.
so in the first 3 years, we form our internal working model, which is kind of like our blueprint or framework for our entire life. And we figure it out really early so we can do life. So the three parts of the internal working model are the view of the world, the view of self, and the view of others. So is the world scary or safe? Are people good or bad? Am I worth loving and taking care of? And am I important? Or am I worthless? Am I not important? Are my needs not worth taking care of? And so a child who has strong attachments, their internal working model is going to be on the end of the world is safe, people are good, I am important and special and worth taking care of, and my needs are important. And when trauma has been experienced, the worldview goes more, and the more severe the trauma or trauma and attachment disorder, the more it goes to that other end. The world is scary, people are bad, and I am not important, I am not special, I'm not good enough, and my needs are not worth taking care of. And so we do kind of get a whole spectrum on there. But our kids with RAD and DDT tend to be at that end of the entire world is scary, everyone's bad, and I have no self-worth.
This is just kind of a thought. A lot of people mention anxiety, and it's really thrown out there as also generalized in one say. If you had to say the difference between a child that struggles with anxiety but generally trusts their parents or has a bond to their parents
Mhm.
versus one child who has anxiety but doesn't trust their parents.
Yeah. The difference is who's in charge and who's going to take care of all these things that might happen. So, in healthy attachment relationships, you're going to have a child with high anxiety, and it's what's going to happen, what is this, what is that. They have to know a lot of information. And kids like that, I will give them a lot of information. You need to know what's happening exactly step by step for 3 hours. Here you go. And they can handle that because they are in an attachment relationship. So they're like, okay, all of this stuff is going to happen and all of these worries, and my parent is here and they're going to take care of it. And they rest in that relationship. And so it's less overwhelming. Now, kids who aren't secure in an attachment relationship and kids who completely lack attachment, like the ones that we often work with, the world is so scary and they think they have to do it all on their own. So all of this anxiety, all of this worry, what's going to happen. And so when you tell them all of the stuff that happens in the next 3 hours, step by step, their brains don't go, okay, now I know my parents got it, and they lean back into that relationship. They go, oh my goodness, I'm just a kid. How am I supposed to do all of this? And it is completely overwhelming. And so if you ever give a child with an attachment and trauma disorder a lot of information, you're going to see this escalation in behaviors. And it just kind of explodes into chaos because we have completely overwhelmed their system and their capacity to cope. So kind of the difference that we look for, because our kids all have anxiety, our kids with trauma and attachment disorders, and a lot of other kids do. It is a unfortunately common childhood disorder. But the difference is who that child sees as being with them in that anxiety. Who's going to step in and care for them? And kids without attachment, there's nobody. And so their perception is, I've got to do this by myself.
Yeah. Wow. And what are some of the misconceptions that people uh, say about trauma and then also like specifically children with trauma?
So a discussion I've had recently also is that um, trauma gets overused. And yes, I
Mm.
think the word, you get into pop psychology and popular cultural things, and it does get used a lot. And it tends to be a buzzword in a lot of areas. But there is also starting to be the understanding of what trauma really is. And so even when I started this work 14 years ago, trauma was very much in a box. If you experienced this event, then you experienced trauma. And if you did not fit into this box, obviously you weren't traumatized, right? So just get
Mhm.
over it is the mindset. And so now there's so much more understanding on trauma is not the experience that happens. Trauma is what we perceive of the thing that happened. So when we experience something like, say, a war zone, severe abuse, whatever it is, that is a traumatic event. When we experience trauma, it's our perception of what happened to us. And the more alone we feel in that, the more traumatized we're going to be. So there's still that misconception that, well, the kid just experienced this, or they were so young they don't remember, and so they can't be traumatized by it. And thankfully that narrative is changing, but we still get stuck on that sometimes in a lot of spaces. So that's probably one of the biggest misconceptions, specifically with kids who are in birth families that we work with, or kids who have been adopted. There tends to be less acceptance that those kids will have experienced trauma. And so adoption, like I mentioned, is still often not seen as something that's traumatic, because this kid has a good family and they have parents that love them and want them, so they should be fine. But adoption is always loss for the child. They've lost at least one set of parents, if not multiple sets, by the time they get into an adoption family. They lose part of their self, they lose part of their identity, they lose connection to their culture and their countries and their people, and there's so much loss involved. So that is a big misconception. And over the last maybe like 7 or 8 years, I've been doing a lot more work with birth families.
Yeah.
And there's have previously, and there still are, those misconceptions of, well, it can't be that bad, well, that can't be trauma, all of the things we hear, right?
Yes.
And so there's a lot more understanding now about things like intergenerational trauma. And when we have parents who were traumatized, they don't have the capacity to pass on attachment to their child. And when a child doesn't have attachment, it is a trauma. It is a loss. It is this, lack of the ability to develop in healthy ways, socially, emotionally, and psychologically. So I'd say those are kind of the biggest misconceptions. And they're getting
Yeah.
better, thankfully. They're getting less.
That's good news. It's good
Yeah.
news. Um, what are some of the things just in our current culture? I know there's so many cultures around the world, but we'll maybe focus on like our experience of culture.
Western culture.
That's making it difficult for children to experience an environment of healing.
Our Western culture is very focused on independence, and independence is a human thing, right? We all have it. But our culture has somehow lost the true meaning of independence, and we become independent through dependence. But our culture has started independence so early that we've gotten rid of the stage of dependence. And so we end up with kids who are at stages in teens and early adulthood where they need that actual healthy independence, but they don't have that dependence part that help them develop the capacity to be truly independent. Our Western culture is so focused on academics and achievement
Yeah.
that we put so much importance on that. And I was talking to someone recently, and their littlest person was starting kindergarten. And I was like, oh my goodness, that's so early. They're so little. And she goes, oh, we pushed for earlier kindergarten so that they're ready for grade 1. I was like, no, 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 lady.
No.
So
Yes.
we've set up this culture, and it's not just parents pushing for academics
Mhm.
or achievement. We've set up this whole societal framework where if you don't, your kids don't get the experiences or the advantages that you want them to have. We've also, and here in Canada, like our housing crisis and our cost of living crisis, and like everything is so expensive that parents have to work more. And so we've created a social environment where parents can't spend time with their kids. And so we're missing out as a society on opportunities for kids to just rest in their family and build those early attachment relationships. Yeah,
Yeah.
Western culture, we've got a lot to learn.
Oh, no
Yeah.
kidding.
We've lost sight of community, and I think that's one of the biggest things in our culture. We no longer live in community, we live individually. Every nuclear family is on their own, and so
Yes.
we've lost the capacity to really genuinely care for each other and in turn really genuinely care for our kids. So,
Yes. Yeah, and even just thinking about the nuclear family, because I think some people, because even if it was a not a double income home because of the crisis, it's still, I think there's, at least from what people are saying, it feels like people are making more and more effort of saying actually how much it is, even if mom is home all day long, that
right?
it's a lot and it's not necessarily enough for the kids' needs to get met.
Yeah. Well, and there's so much pressure. So even stay-at-home moms or stay-at-home dads, stay-at-home parents, there is so much pressure on them by society that so many parents feel guilty for just being at home with their child, just focusing on their child and that early attachment. And it's always like, your baby's this old. Why don't you have them in these activities? Why aren't you doing this? Why aren't you doing that? Why aren't you, like, so many expectations. And again, we've lost community where we have people to step in and help out, and neighbors and friends and family.
Yes. Yeah. So I like the word that you used about, was it resting? Resting in their families?
Maybe.
It was, I was like, oh, I like that. That's nice. Because one thing that you really hit on really well in all of your trainings and your programs, is this idea of felt safety
Mhm.
and safety in general, but particularly safety is more than just like, oh, no one's actually out to get me, so I'm fine.
It's going to attack you. Yeah.
Yes. So yeah, what would you say about felt safety?
Yeah. So felt safety, a lot of the stuff comes from the work of Karen Purvis. And she's got, like, her work on that is really great. And then more recently, within the last maybe year and a half, I've got into the work by let me think if I can, the Australian Childhood Foundation. Pretty sure that's what they're called. They talk about the same concept. They call it deep safety. And I really like that term. So, felt safety is the feeling of being safe. And those of us who have healthy internal working models, we view the world as safe and people as good, and ourselves as important, which means we can go out into society and we can walk in the streets and we can go into a room of strangers and we feel safe. We know people are good, nothing's going to happen. And if something does happen, it's the rare occurrence and it's not the norm for us. People who have experienced trauma lack that feeling of felt safety. And so they go anywhere and meet people they don't know and even people that they are familiar with sometimes. And it's that tension of, oh no, something bad is going to happen. And even if nothing bad has happened to them yet, they're gonna be like, something will happen because the world is scary and people are bad. So the core foundation of therapeutic care, and I would say even before nurturing and attachment building by parents, is felt safety. Because
Yeah.
if you don't feel safe, you can't rest into those relationships and into that sense of family, and you can't relax the tension enough to start learning better ways of being. So felt safety, it's got to be the most important thing that we do. And so, yeah, that feeling of being safe and that deep internalized feeling of, I'm gonna be okay.
Yeah. So over the years of all the working with all the different families you've had, different programs you've been involved in, um, what do you think is the best resource or combination of resources for families that are struggling in this, and why?
I think one of the important things is, and I like your use of the word combination, because it's got to be a combination. And there is no one program that's going to fit every need a family has. So we've got to use holistic care, which means, and holistic in several ways. So holistic for the entire family. And treatment or care and techniques can never be just on the child or children with reactive attachment disorder or DDT or trauma and attachment disorders, whatever the spectrum is. It's got to be everyone in the family, the healthy siblings in the home and the parents. We've got to take care of everybody. And then holistic also in the way that we've got to pay attention to physical, emotional, mental, and spiritual health of every person. So no one program is going to cover all of those things for every person in the family. So you got to have a combination. And then there's also a difference in learning styles. So I just spoke with someone the other day who had read my books. And they were like, oh, reading things is just the best way I learn because I can go back over and over and highlight it and figure it out. And I've had other people who book consultations. They're like, I tried reading your books and I just need someone to talk this through with me. Or they will come and work with me in person because they need to see it in action. So a combination of programs. I do think reading has a lot of value, whether you're reading like a physical book or an audio book, because you can go back and listen over and over again. And you can reread it and put it down and pick it up again. The courses we teach through the ranch are really impactful because we focus on practical information. So not a whole lot of theory, although we do, of course, have some of that, but it's like, this is the problem you have. Here's how you can deal with it. This is the thing that we want to start changing. Here's how you do it. And in our online courses, there's the Q&A. So we're able to say like, okay, we talked about this technique. And they're like, well, what do I do when my child does this? Or my child's going to have this reaction. And we can troubleshoot right there and problem solve. So a lot of families do well with using those techniques from things like the books or the online courses. But then the best combination is those and working in person, because you can listen to the explanation of a technique and you can read about it, but it's very different than seeing it in person. So a lot of what makes care or the techniques we do therapeutic is how we do them, the delivery, because the person, whether it's the adult in charge or the parent, is the most important therapeutic technique, more than anything else. And so it's how do you look at your child and how do you phrase the thing you've got to say in the best way possible, your therapeutic language, and what tone of voice do you use and how do you stand and what does this interaction look like? What's all the body language? And that's very hard to do online or through a book. So in person is just really fantastic for that. So starting this summer, you and I are launching our new in-person program, which I am so excited about. So we've got let me see if I can get this straight. What do we call them? Therapeutic Parenting Intensives.
Yes.
There's so many words for everything. Therapeutic
Yes.
Parenting Intensives. And so they're intentionally designed to kind of cover a whole bunch of things. So it's kind of a combination in itself. So it's designed for parents who already have an understanding of therapeutic parenting, whether that's through one of my courses, they've started implementing it through different programs, however they get there. And then we're having families come to a home away from home, kind of a family getaway environment. And that right there has the benefit. If you're familiar with the work of Bruce Perry, you've heard him talk about the doorway effect. And it's when we physically go into a different environment, our brain acts differently. And we're often much more open to learning. So for families, what I've seen a lot is that their home environment is so chaotic and so full of failure that their brains get stuck in that. And it becomes our home is a failure. We can't succeed because this is how it is. And so when we're able to get families out of that and bring them into this home away from home getaway environment, it's that doorway shift. So we've got a great bonus with that. It also takes parents out of busy everyday life. So they're not stressed about work and school and schedules and all of these things that they've got to do, all of the stuff. They get to come and really focus on therapeutic techniques. So we get the getaway part in there. And then Sarah Jane and I spend the day in person working with the family. And so Sarah Jane, I was trying to remember the other day how many years you've trained with me, and it's got to be 4 or 5.
Yeah, at least.
Yeah,
So,
it's
yeah.
quite a while. So Sarah Jane, she's a fantastic therapeutic respite provider. She really gets the trauma responsive part. So she gets to do kind of what we call our kids program. And so it's the respite care part where she's able to help kids learn new, more effective skills and ways of being. And we're going to have different activities for kids to participate in. We do have some of these during the summer, and then some will be during the school year. So kids can bring their schoolwork. And Sarah Jane's going to be able to help them through that in a way that helps to bring that sense of felt safety and that therapeutic trauma responsive part. And then I'm going to be able to work with the parents on coaching them. So we're going to go over different techniques. Okay, this is a technique that you learned or we've talked about in courses. Here's what it's going to look like practically in person. And we have opportunities to be able to model that right there in the family. We're going to be able to sit with parents and help them do things like safety plans. And safety plans are so important for physical safety for a lot of our families, and then also that felt safety. And so many times when I teach courses, I'm like, we're going to talk about this technique, and then when we're done this session, in your spare time, go and write your safety plan, and go and write your daily schedule, and go and write and parents can't, because it's so chaotic at home and they're so exhausted. So this home away from home, when I am right there with them, allows them the opportunity to be like, okay, we can do this. And if any questions come up, what do I do with this? How do we do this? I'm able to coach them through in the moment. So I'm really excited about that. And then we're going to spend a good chunk of every day also really facilitating the parent-child bond. And so working on different techniques for that, giving parents practice with it, giving kids practice with it. And really setting families up for success where they can take these skills that they've learned at a new, deeper level and take them home and succeed. So I am so excited about it.
Yes. Yeah, me too. And I love how you explain the Dr. Bruce Perry's why the different environment because you're trying to find the sweet spot, right? Being
Right.
like it's at home where all this happens. But
Yeah.
yet if we just do it in your home, it just doesn't get the brain primed in the right position in the right place to be and the separation that it needs, even though you're gonna have to eventually take it back home, but it sets you up for greater success.
Yeah. And I've worked in home with families for almost 14 years now. And it's always, no matter how much you tell families, like, I'm there to coach them through techniques, right? But you've also still got to kind of do normal life so that they can get an idea of what it is. And so often we spend so much less time coaching than would be ideal because everyday life comes up. The neighbor stops
Yeah.
in, the dog gets sick, the school calls for this, dad's got to work late, mom's got to run into the office. Like, it just happens, right? And so you deal with it and you work with it. So this new program, the parenting intensives, we're going to kind of have the best of both worlds. It's still home life where the parents are going to be in their getaway vacation rental and be able to do their normal life, but without all of that additional stress and chaos that comes with normal life.
Yes, so we are looking forward to that. So what is the best way for people to contact you just to maybe get more information and see if this is a good fit for them?
Yeah, so there is some information up on the website. Oh, let me think if I remember. I think it is just the radishranch.org and then / therapeutic parenting intensives. That should get you there.
Yes. I will try
On the
to,
website, I think it's
whoever's putting
under the
this video
parenting
up.
tab. Yeah.
Yeah, we'll try to get the links in the video too.
Yes.
So,
Yeah, if we can figure that out.
yeah.
Yeah, so there's going to be information on the website. And then contact me through the RADish Ranch or contact Sarah Jane through St. Joseph's House of Repose. And either one of us or both would be happy to, answer your questions. If you want to know, is this best for my family? Is this going to work? What does it look like? All of that, we're going to be able to help you with those answers.
Awesome. Well, Karen, I appreciate just all your expertise. And Karen has worked with a couple families that I've worked with, and I see her, and it is good. And she is good at personalizing it to your needs at your families because trauma is not a black and white situation. It's not like here, this is a bike, how you put it together.
There is
Every
no
kid
one
is so
size fits
unique.
all.
Yes. So she's really, really good at that. So she's working really hard on trying to, I mean, we can never really know a person as fully as we want to, but she's working so hard to try to get the kids these best opportunities and the family unit as a whole. So thank you so much, Karen.
Yeah, anytime.
Okay. Take care.